Yep. Good morning and welcome. I'd like to introduce you to Helen Fletcher, who will be talking to you today about the Health and Context Outline Call that closes on the 2nd of April. Helen.
Okay, thank you, Sam. So I'm here today to talk on behalf of GCRF, the Global Challenges Research Fund, particularly one of our calls that we have open at the moment, Health and Context. And this call is cross-discipline and cross-research council. So here in the room today, we have representatives from the Medical Research Council, the Arts and Humanities Research Council, Social Sciences Research Council, and also the Natural Environmental Research Council. And so between us, we're hoping that we'll be able to answer any questions that you have. And the questions you can ask us, those of you who are registered online, you can type your questions. We will be looking at your questions as we're going through the slides, and then we'll answer them at the end of the presentation. Okay, so just to tell you a little bit more about the GCRF, because I think understanding the GCRF will help you to frame your application. The Global Challenge Research Fund is UK aid money, and it's part of the UK's response towards the Sustainable Development Goals. So there are 17 Sustainable Development Goals listed on the slide here, and the GCRF Fund covers all of those. And this is a very broad collection of research. And so what we've done within the GCRF is consolidated our activities within 6 different portfolios. So we have the food portfolio, education, global health, cities, resilience and conflict. And then highlighted in bold here, we have those Sustainable Development Goals, which are cross-cutting across all of our portfolios. So when we're doing research in food or education or global health, we're also looking to reduce poverty, improve working conditions, we're looking for gender equity, and we're looking for partnerships. So to try and consolidate those 6 portfolios and to strengthen the impact of the research, the GCRF appointed challenge leaders who are academics on secondment, who will be looking at the grants that we've invested already and trying to draw out the impacts, but also looking for gaps within the various portfolios, to putting out funding calls to try and strengthen what we're doing and bring coherence within our portfolio. And so these are our challenge leaders here. So we challenge leaders in resilience, conflict, cities, food, education, and myself as a challenge leader in global health. And so what we've done is to help strengthen these 6 portfolios is put out a series of funding calls, so 16 funding calls in total across our 6 different portfolios. And the idea of these individual calls is that they're strengthening and bringing coherence across the whole of the GCRF funding. And so there's a link, a web link at the bottom of this page here, which takes you to our central GCRF website, and you can see all our calls listed there. So the calls are open between January this year and June, and funding will be coming through from the beginning of next year. So we call this collection, if you like, of our 16 calls the UKRI GCRF collective programme. And more specifically, we have within the cities portfolio, we're rethinking the off-grid city. We're looking for sustainable energy and international development. We're looking at education as a driver of sustainable development, education in conflict and crisis, and education interventions for early childhood development. So for food systems, we're looking at the culture and histories of agriculture, food and nutrition. and we're looking at a combined food systems approach for developing interventions to look at the double burden of malnutrition. And then we have the health and context call, which we'll be talking about in more detail today, but also called in equitable resilience, multiple and systemic risks, and under security and protracted conflict, refugee crisis. We have our development-based approaches for protracted displacement, preventing conflict, building sustainable peace, and protection in context of conflict and displacement. So the health and context call, which was developed jointly with everybody who's sat in this room today across the different research councils. It was also developed in collaboration with DFID, and it was developed with a view to looking at the whole of the global health portfolio and seeing where in the past we had success and where we felt that there was we could strengthen and build on previous work. And so those of you who have applied for GCRF funding before may remember that in 2016 there was a call for infectious and non-communicable diseases. These were foundation awards of around £600,000. Those grants are just coming to an end, and it was partly looking at the research in those awards and seeing the real potential for building on that, that we came up with our health and context call. And as you'll see, the remit isn't just restricted to those foundation calls, but is slightly broader to allow for a more interdisciplinary approach. And by that, we mean that we really are pushing you to think about the social, cultural, historical, and religious beliefs and practices, as well as biological, ecological, and environmental factors which may impact infectious disease or non-communicable diseases. And we want you to look beyond scoping, so beyond descriptions of what the interactions might be, and actually coming up with interventions that you can test, where you can look at the relationship between infection and NCDs and these broader factors, and look at them together for improving either the treatment, the diagnosis, the management of these conditions, or even their prevention. Okay, so a little bit more detail on what we're looking for. So what is it that could be driving infection or non-communicable diseases? What do we mean by biological context? So here we mean this could include the genetics and genetic susceptibility to disease, or it could include underlying immune status and how those two things could increase risk of disease. But those things, not in isolation, but those things also in the context of how people are living and how they themselves may be influenced. In the social cultural context, what do we mean by that? So we mean, you know, how might your traditional beliefs or practices, or your workplace, or the role of gender in society, or religious belief impact the way that you are susceptible to disease, or that you access treatment, or puts you at risk for developing an NCD, or again, perhaps impacts the way that that disease is managed. For the environmental context, then we're looking at things like air pollution, water pollution, you know, again, how your work environment may impact or drive the risk of developing an NCD or infection or responding to that. And when we say we're looking for interventions, then those interventions, they can be the medical interventions that you'll be used to looking at from MRC calls, but they could also be behavioural interventions, and you may also leverage social cultural mechanisms for trying to improve treatment outcomes in a way that you couldn't achieve if you just took a medical approach. So you'll see the word interdisciplinary on most of our calls, so not just this health and context call, but the other calls that we have within GCRF. And so what do we mean by that? What we mean is that we're not looking for a solution that is purely medical or purely social science or purely arts and humanity, but we're looking at combining those things together and really creating new solutions and so addressing problems which on their own from one perspective have remained intractable, so we've not been able to solve them purely by a medical approach, and actually what we need to do is step back and look at the big picture and try and do it together. So interdisciplinarity can cause people a lot of confusion when they're writing their grant proposals, and we had some really great advice from a previous GCRF applicant last week, who was saying that you will never achieve 100% interdisciplinarity. So don't think that you have to have a tick box of all these different disciplines working together in your proposal at every single level. It might be that you have several different aims within your proposal, and some of those aims lean naturally towards one discipline than another. That's fine. We will be looking at how the whole proposal fits together and how the whole proposal itself is interdisciplinary. And it doesn't mean that every single aim within that has to be mixed between the two. And the mix of disciplines also has to be appropriate, and it will be obvious if you're just bringing people in for the sake of it. So one thing that we will be looking for is community engagement. So this call is entitled Health and Context for a reason, and that's because we really want it to be rooted within the communities who you are hoping will benefit from the research that you're doing. And we would like to see evidence right up front that people have been involved in either the development of the proposal, or that the people developing the proposal have a very deep understanding of the community that they're working with and the needs and demands of those people. We, as with all GCRF grants, then capacity building is important, and while you may not have a specific work package on capacity building, we would expect to see evidence of capacity building throughout your proposal. And so these, in terms of size, they are larger than those foundation awards. We're looking at funding projects of £1 to £2 million each, which we hope will give you the resources that you need to achieve impact and actually develop and test interventions rather than just identifying and scoping activities. So who can apply for this call? So this Health and Context call is open to principal investigators from academic institutions based in the UK and those based in low and middle income countries. So you can apply as a principal investigator directly for this funding if you're based in a low and middle income country, as well as if you're based in the UK. If this proposal is led by a UK PI, then it is particularly important that you demonstrate that equitable partnership with your collaborators. It's expected that you would have collaborated in low and middle income countries. It's expected that this would be a true equal partnership and that you would have developed this proposal together. And again, we will be looking for evidence of that within your application. So higher income country co-investigators are permitted on this proposal, but we would expect them to be providing expertise which couldn't be found within the UK or with the low and middle income country partner. So this slide tells you a bit about the timing of the call. So the timing is that we opened the call on the 24th of January. It's a two-stage process, and we will be expecting letters of intent by the 2nd of April 2019. At that point, we will sift the letters of intent, and in June 2019, we will let you know if you've been invited through to full application. So the full applications we would expect by the 12th of September, and we will be hoping to make funding decisions by January 2020. And here we've got a few slides just to try and help increase your chances of success in applying for GCRF funding, not just this call, but our other 16 calls which are open. And what we would like you to remember is that primarily we are looking, as across the whole of UKRI, we are looking for research excellence. And so the quality of the research remains our primary criteria when we are assessing applications. Also equally important for us is that your work is ODA compliant. So this is official development assistance. There are guidelines available on our website, but also on the OECD website. If you're not sure, you can always send inquiries. But it's an absolute requirement that your work is ODA compliant. As I mentioned, we will be looking for evidence of that equitable partnership, and we would expect at every point in your proposal to see capacity building as well. If not explicitly, then as a sort of secondary aim, if you like, within your proposal, we would expect to see that capacity development. And we want your proposal to be focused on the challenge, if you like, so focused on the problem. And if you focus your proposal on the challenge that you're trying to address, then that will help to bring in that interdisciplinarity. So if you look at your community, the country, the context in which you're working, you've identified a particular problem that you want to work on, and what you should immediately see is that that problem is not going to be solved by looking through the lens of one academic discipline, and that problem is going to need multiple partners with multiple expertise, and that should be what is driving the interdisciplinarity. So start off with the problem and work from there. Okay, so just a little bit more on partnerships. And, these equitable partnerships are challenging, and we appreciate that they take time to develop. And that's partly why in this call we have a two-stage process. It was important that we gave you time to be able to develop these partnerships. And the opportunity of having these interdisciplinary and equitable partnerships is that you will see innovation. That group of people who you're working with will force you to think in a different way, and you'll find some innovative solutions. The challenge with that is that you'll also have competing priorities, interests and expectations. So again, you will need that time and to communicate with each other and to find that innovative pathway that you can all agree on. You will have sharing of knowledge and expertise, but the problem here is that particularly if you're looking at people who are UK-based versus low and middle income country-based, you have different access to different capacities and different resources. And again, I think as the UK partner, you have to be conscious of the fact that the people you're working with may not have access to the same resources, and so again, you need to be sensitive to that and give people opportunity, give them the information they need, and the background that they need to be able to contribute to the development of the proposals and also to be beneficiaries of the research. So on that equitable partnership, these are just some of the criteria that we will be looking at in your proposal as evidence that you have co-developed your research. Firstly, we will be looking for that joint agenda setting. So we will be looking for evidence that there is a mutual agreement on the meaning and the purpose of the work. So the challenge that you're trying to address is mutually agreed as important. It will help if you have some clarity of the roles and responsibilities of the different partners and fair recognition of the interest and incentives for people involved in the research. We would expect you to build mutual trust and to be transparent and accountable in your decision making, for example, on your budget. We would also expect evidence that you will have regular communication, and it wouldn't just be a case of setting up a project at the beginning and then 2 or 3 years down the line contacting your partner to let them know the outcome. We want to see that there is continuous engagement throughout the project. And we would hope, and we try to give you some time to invest in building these partnerships at the beginning. It would also help if you could show that you are conscious of reflecting on your own partnership and assessing the health of the partnership as you go through the proposal. And you may even want to develop some kind of process for dealing with disputes. So partnerships are not just academic, and if you are thinking of developing interventions or influencing policy change, then you will also need to include other organisations. So these could be NGOs, they could be governmental agencies or other multinational bodies. And so if the question, when you look at your challenge not just in terms of the different academic disciplines which are going to be needed to understand and develop solutions, but who's actually going to implement these solutions, who's going to be using these solutions, and try and include these people as partners on your proposal as well. And you'll hear, there's a lot of us who work in research with low and middle income countries. We talk about policy change, and what we would hope is that the research that we do would impact the local policy and maybe even national policy and international policy and improve the health and well-being of all. But this slide here is just a reality check from DFID, and they're saying here that what you have to remember is, yes, it's fantastic to engage policymakers in the research that you're doing, but remember that these people are incredibly busy and use their time very wisely. And often there are national processes and meetings and routes for contacting and interacting with policymakers, and try to use those rather than avoiding and try to avoid having standalone meetings, because otherwise these policymakers are going to get exhausted and they're going to hear multiple different things from multiple people. And also remember that the best way to influence policy is to represent robust research and evidence, maybe even the format of a systematic review at a much higher level. So the piece of work that you're doing is likely to be just a small piece of a much larger jigsaw puzzle of evidence, which may ultimately impact policy. But don't immediately think that the small piece of research that you're going to do is going to be taken up by a policymaker and immediately have impact, because in most cases this isn't the route, and you will just annoy and potentially alienate the people who you're trying to influence if you lobby them too much. So yes, we do want you to have an impact, but just some words of caution, and that there are right and wrong ways to go about doing that. Okay, so I was asked a couple of weeks ago to, if I'm looking back on the GCRF research portfolio so far, so in total we've funded about 800 proposals across our 6 different challenge areas. then what is likely to make a successful proposal within the GCRF? You know, the first thing is to keep your research challenge-led. So if you focus on the problem that you're trying to address and then arrange your partnership of academic disciplines, NGOs and other actors around the challenge that you're trying to address, then that is what makes this a GCRF fundable project. And we will be able to see if that partnership that you're building is a true partnership in response to the need, and it is obvious if you're just adding disciplines as an add-on. But more than that, we are expecting the partnerships that you develop to be equitable, and we will be looking for evidence of that in your application. And finally, if you get that partnership right, so if you get that mix of academic disciplines and NGOs and you know, policymakers, government actors, non-government actors, if you get that partnership right at the beginning and everybody is bought in and everyone feels ownership of it, then that is what drives both research quality and drives the impact of your research. So I would say think of your challenge and think of your partnership. You get those two things right and you will drive high quality research and you will drive impact of research. So, yes, thank you very much. And so there has been questions coming in as we've been going through the slides. So I'm going to hand over to the team here to address some of your questions. And the great thing is because we have people here from all the different research councils in your different areas, then hopefully we should be able to answer most of your questions. Now there will of course be some questions that we can't answer, in which case we will go away and find out the answers as best we can and feed back to you at a later date. So Sam, I'm going to hand back to you.
Yes, so one of the questions that we've received is in regards to eligibility, which Helen has pointed out that this particular call is open to both principal investigators in LMI countries plus UK countries. We've also had a number of queries in regards to nutrition and asking whether you can have an element of nutrition within your applications. And I'd like to just refer to Dr. Philip Woodgate, who'll be able to go through what you can and can't do.
Yeah, so originally we had kind of a broad view that nutrition would be out of remit for the current call. I think that's changed slightly to a position where we will accept nutrition research so long as there's not a more natural fit for it within another call that's open at the moment. So there are 3 calls that are open. We have one run through the MRC, which is all about looking at mechanistic links between nutrition and non-clinical disease. So kind of what are the changes in someone's diet that can increase the risk of developing NCDs. So if you're looking at the real kind of biological mechanistic level, then we'd urge you to submit to that particular call through our population and systems medicine board at the MRC. There's also an AHRC collective fund activity, and that's looking at the role of culture, history and society on nutrition and food systems. So again, if your research would fit better within that remit, we urge you to submit to the AHRC collective fund activity. And then finally, we have the Biotech and Biological Sciences Research Council call, the BBSRC, which is looking at nutrition in the wider scope of agriculture and food systems and how we address that double burden of malnutrition, so either malnourishment or obesity at that real systems level, so looking at everything from agriculture right the way through the food chain, food production activities up until food consumption. So if your research would fit better within any of those 3 activities, we'd urge you to submit it to those. We will do the remit check when we receive the application, and if we feel like it would fit better within one of those other activities, then we will let you know. But if not, then you would be welcome to submit a nutrition application to this call.
Thank you. We also have another question. We would like to know whether mental health and developmental disorders, including intellectual disabilities or autism, is eligible within this call.
Yeah, so that's a good question, and you know, again, there are other calls in mental health, and Naomi, the SLC got a call.
We don't, in mental health currently, we don't have a call, so we're including mental health disorders within this call as part of a non-communicable disease. Developmental disorders is an interesting one that hasn't come up yet, and there is a kind of body of activity around kind of early childhood development. There's a specific ESRC-led call on education in relation to early childhood development, and there's also a broader kind of group of funders who are interested in that area. So the British Academy and DFID are part of that, and MRC are part of that collaboration looking at early childhood. So for that particular inquiry, I would suggest they contact us with a summary of what it is they want to do, and we can advise them on which is the best activity for them to direct that to.
Wonderful, thank you. We also have a social question. Do social factors include also social policies, welfare policies?
That's a good question as well. I think when we're talking about context, we're talking about kind of the kind of lived experience of people on the ground. So that, you know, social policies affect people and their lived experience, but we wouldn't want a proposal that's solely policy focused and is not kind of focused more at the community level.
Okay.
I think is that a fair?
I think that's fair assessment. Yeah.
Yeah. So obviously we're very interested in policies and the impact they have on health and people's lives.
Okay.
But I kind of pitched it at the right level. But again, if people want to contact us with some more details on that, we could talk about
that. Would be good, wouldn't it? If you have any concerns, contact us directly, maybe with a copy of an abstract or a short summary of the research that you're looking to do.
Yeah.
Would be definitely beneficial.
I think with policy research, it's all about bearing in mind that context-specific element and how the work that you're doing is grounded in a particular context. And going beyond the description of how that policy may be impacting health within a particular community. So again, really trying to see the kind of causal links that policy is having on people's everyday health.
I think this is where the engagement aspect of it kind of comes in, of seeing how engaging the research with the community themselves and engaging with the populations that you're working with.
Okay, so something slightly different. We have someone on the line that their organisation is the Public Health Centre of the Ministry of Health of Ukraine. Is a state institution. Can they apply as a principal investigator?
That's a very good question. Without knowing too much about the institution, it's hard to say. I'd have to go and have a look at the institution. But if they're a public health body conducting research, then that normally is fine. But we would check and make sure, so we can get back to you on that.
Okay, brilliant. So we then have one. Thanks for a very useful presentation. Thank you for Matthew on that one. Can you clarify if an MSc or a PhD study fees can be written into budgets for this cause?
No, in a word. So through GCRF, we can't fund any PhD or master's stipends or studentship fees or anything, I'm afraid.
Okay, thank you. And we also have one, would cognitive impairment in older people fall within this remit?
Yeah, I would say so, yes. So, that's, it's aging, it's an NCD, it's an important area of research globally. I would say that will fall within remit.
Yep.
Brilliant, okay. So we have one, does the call implied some hesitation about accepting applications, including an RCT? If we believe and can demonstrate that the RCT is the best tool to address the challenge at hand, will applications including an RCT be at a disadvantage?
They won't. The thing with RCTs is the amount of resource that they may require.
And the time.
And the time, and whether they can actually achieve the aims of that RCT within the space of 3 years.
And within the budget.
Yeah, if the applicant is confident that they can meet both those budgetary and the time restraints, then by all means RCTs are eligible to be submitted. When we convene the SIFS panel to look at the outline applications, we may, depending on the resource, redirect them to other schemes, things like the Joint Global Health Trials scheme, which is dedicated funding mechanism for RCTs. But as I said, if they feel like they can put together an application for an RCT within the timeline, within the budget, then by all means.
Okay, brilliant. So we then have one particular person who is interested in cancer care and social care, empowered by informatics. Is this something that we would be interested in?
It certainly sounds multidisciplinary. So yeah, cancer care would be well within remit, and bringing together those quite diverse group of people to address a very large-scale challenge, yeah, from my point of view.
Yeah, and I think I would say there that if you're doing, an informatics-based project, a database project, then that would be where I would really expect to see some engagement of local helmet researchers and the community that you're working in, and some clear demonstration of who's going to benefit from that research, who benefits from the publication, who owns the data, and how is that data going to be used. So I guess that's where, an informatics-based project, a GCRF, may differ from an informatics-based project to a normal MRC board, is that we would really expect to see co-development of the project, and the beneficiaries are not just UK-based.
Wonderful. We have had a couple of questions from people in lower middle income countries with concerns over can they apply directly to us without a UK partner, and if possible, is that eligible?
Yes, very simply.
Good.
If it's solely a UK PI, then we would expect that strong kind of equitable partnership with a low middle income country investigator. If it's coming directly from an LMIC, then that's fine.
Excellent.
And can I just add as well? So I would check within your institution whether your institution's applied for MRC funding before, and if they haven't, then register on the UKRI kind of application system as early as possible, because it can take a bit of time for that registration to go through. Otherwise you get a lot of last-minute panic.
Yeah, I mean, and what we do appreciate is for those people who are based overseas who have never applied for research council funding before, you may be at a disadvantage compared to a UK-based PI who's very used to our systems and to what we're looking for. So, sometimes it may be an advantage to you to have a UK-based PI or advisor or co-I on the project, just to help you sort of navigate our systems, but there's no reason why you couldn't apply directly.
Wonderful. We have one. Do you have any expectations to the budget split between UK and LMIC researchers? Also, the private partner costs eligible?
So we don't have any expectation of the split in the budget, and I think it's a difficult question, because staff costs are different. If you're doing expensive laboratory assays as part of your application, then you may see more of a budget landing in one place than another. I mean, it really depends on your research proposal, what it is that you're trying to do, as to where the money flows, and it's not as simple as splitting 50-50, because it depends what the work is and where it's done and who it's done by. But we will be looking for equity in a proposal. We will be looking for fairness, if you like, in how the work is distributed. But it's not as simple as saying, money has to be split 50-50, because science just doesn't work like that. So yeah, I don't know whether anyone else wants to add to that.
No, just to echo what Helen said. The main concern should be the equity rather than the quality of the funding split. Having said that, if we were to receive an application that's 95% of the costs staying in the UK and only 5% were going overseas, then that's likely to be something that a funding panel would pick up on, because it would be very hard to have an equitable partnership if there was that much of a skew towards UK costs.
Okay, and I think the one other thing is that we won't dictate to you the limit necessarily for your grant. However, your costs are there to be fully justified. So if you feel that you need £2 million, for example, you need to justify that in your application. So we can actually see what you need those costs for. We do have one in regards to how would you view an application which sought to address a similar challenge across more than one country, particularly as synergy in the choice of countries is demonstrated.
Well, I mean, that would be viewed very favourably. We are, we're asking you to think about the context in which you're doing your research, in the hope that looking at a particular context and finding a solution that works in one place could well be applied in other places and could well lead to the development of solutions in other places as well. So, yeah, we would be happy to see that.
Excellent. So we've then got one. Do the applicants have to look at both infections and non-communicable diseases, or could it be either?
Oh, yeah, absolutely not. I mean, to be honest, unless there was a very clear overlap between infection and NCD, for example, infection as a driver of cancer, I would discourage you from trying to do everything at once. I mean, I think it's enough focusing on one of those. Yeah.
Brilliant. And can principal investigatorship be shared between UK and LMIC academies?
It can. So for kind of operational purposes, we'd need one person to be named on the application as the PI, but it can then be made clear in the case of sport that there is this kind of equal split of responsibilities between the two.
Okay. And is it possible to use this call also for the creation of a research partnership platform to allow future studies, to allow the assessment of the interplay of biological and social factors? Could this be a secondary aim of the call?
Well, I think if it was a secondary aim, then, that leads to sustainability of the research that you're proposing, then, I think that would be a positive thing. This call is not just about building networks and building platforms. We actually want, more sort of impactful interventional research. If as a consequence of doing your research, you have created a network of people and can demonstrate that that's sustainable, then that would be very positive. But it should not be the sole aim of the application.
Wonderful. And then can we involve local initiatives already ongoing in LMICs? Can this include commercial operations?
Can they involve local initiatives? So
yeah, can they involve local initiatives already ongoing in LMICs? Can this include commercial operations?
So we would expect there to already be some kind of foundation in place from which to build on. So if we're really pushing this idea of having impact and these quite fairly large scale awards, we would expect there to be, if not a fully formed partnership in place, at least some collaboration, and that should hopefully include local initiatives. I'm not sure if that's the answer to the question they're posing.
Maybe it would be good if you could pop that onto an email to me, and then we can have a look at it further and come back to you directly.
But I think from a I don't know what they're getting at, but from a kind of, you don't have to come up with an entirely new intervention that, you know, if there's something going on the ground already that you want to, you know, be involved with and assess whether it's working, that's fine. It's kind of like a real world intervention, and that's fine.
That's okay.
But I'm not sure if that's what they're getting at, so you're right. I think you probably need that on an email.
Yeah.
That would be good.
So we want it to, we want them to engage with local initiatives that may already be ongoing. That's absolutely fine. But we also want them to be answering a new research question. Yeah. So we're not providing follow-on funding for the same kind of initiative that's already up and running, trying to address a particular question. But those initiatives can, by all means, be included in trying to address a specific health and context-related question. And
there was a question around commercial links.
Yeah, and I did another one about that as well.
Yeah, private involvement. I don't know. I mean, is that the kind of thing where it would be on a case-by-case basis? We would have to, you know, what is the commercial involvement? You know, is it a partnership where services are being given for free, or is there any expectation of money? Is there intellectual property? Who is the beneficiary of that? I should think. I mean, Phil, what?
Yeah. So when a commercial collaboration is proposed, that's great if it's adding to the potential impact of what is being proposed. You would need to fill in a MICA form, which is a model industrial collaboration agreement, when you submitted your application. We'll have to get back to you in more details, because I'm not sure whether that's the case at the outline stage or just at the full submission stage.
It will be at the full submission stage.
Okay, so at the outline stage, maybe just a bit of background about what exactly this industrial partner is bringing to the table. We wouldn't expect them to be taking any funding from UKRI, but they would be included as a project partner. So there's a separate section of the GES form, which is the portal you use to submit your applications, and that is where you list all of the partners involved in the research that are contributing. It may not be a financial contribution, it may be an in-kind contribution of things like assay libraries, for example. So yes, industrial collaboration is fine. You'd have to submit a MICA if you're invited to submit a full application, but in the outline just make clear exactly what role that industrial partner is playing, and list them as project partner.
So just to be clear, the industrial partners could not receive funding from MI?
No.
Okay, brilliant, thank you. And then we have one last question. Do they have to look at one type of disease or certain problems of the health system that may affect multiple diseases? So do they have to focus on one type of disease, or could they look at multiple diseases in those countries?
So they don't have to stick to one disease, but as we said earlier, the scale of the funding on offer might mean that they're better able to have impact if they are focusing on a more specific area. Also, the issue would be whether there is a contextual link between the driver of NCD infection and more than one NCD infection. It might be quite hard to establish that causative link between multiple health outcomes.
Wonderful, thank you. I think that is all of the questions. And if anybody has any further questions, please send them in. What we can also do is take these questions away and come back to you directly. So you've got my email address if you have any further queries or questions in regards to the slides. And no, I think we are. Yeah. Oh, okay. Sorry, there's one more. Okay. Can you confirm that injury prevention research is in scope?
So the initial focus of the call is infection and NCDs. So injury prevention isn't excluded, but it's not entirely within scope either. I would encourage you to look at the other calls that we have from the GCRF under resilience in cities in conflict, to see if it might be something that fits there. I suppose it depends on the context of the injury. And is this, prevention of road traffic accidents, which may then fit more into a proposal on cities rather than on city sort of design, rather than the health call. So I would broaden and read carefully the call text for the different proposals. And if your injury prevention doesn't fit comfortably within the other calls, and you think it fits comfortably with us, then this is exactly why we're having the letter of intent stage, so that we have an opportunity to look at that and make a judgment whether it is in scope or not.
Okay, we've had quite a few more queries now. Matthew's collaborator is a private sector non-profit healthcare provider in an LMIC. They have had loads of intellectual input in the proposal and would ideally co-PI. Is there any reason they should not co-PI and be instead funded through the budget of an LMIC academic partner?
We need a bit of information about who the LMIC not-for-profit are, and once we run our own eligibility checks on them, then we can make a decision then. But in theory, there's no reason why they would have to partner with an academic institution within that country. Okay,
wonderful. And a nice easy one. Can we please confirm whether Jordan is eligible to join in the bidding process?
I'm going to have to Google the DAC. Yes, it is. So Jordan is a middle-income country. Yeah. So yes, so this is low and middle-income country, so they will be eligible.
Yep, so we're confirming that Jordan is eligible to join us in the bidding process.
And you can confirm on Google.
It is. Yeah. Low and middle-income country.
Yeah. Brilliant.
Fine.
Okay, so we have one on nutrition. With proposals focusing on nutrition as it relates to infant feeding and undernutrition still be excluded if they are trying to adapt programmes to be context-specific?
So I think this is where it would be really great to have, an abstract or summary of the proposal, so that we can see which of the calls it fits into, because that might be one of those proposals which fits into the nutrition call. And to be honest, I think, nutrition is a narrower focus than infection and NCDs. So in terms of, if you're a nutrition application competing with all infections and all non-communicable diseases, then that's going to be tougher than if you're applying for a nutrition call which is focused on nutrition, would be my advice. So I think, we are looking to help you. We want to find the best research. So, send it in as an abstract and we will tell you the best way to go.
Brilliant, thank you. What levels of capacity development are most relevant to this call?
Yeah, it's a good question. So we had a question earlier on about whether we can fund PhD and master's students, and we can't do that within this call, but we can and would expect to see research capacity development. So we would expect to see evidence of, sharing of data, of protocols, of, encouraging and helping colleagues to develop their own ideas and write their own applications, to, just look at your research proposal and look for the opportunities in capacity development that you can deliver through your research and through your research collaboration. But, as we said, funding studentships we can't specifically do. But actually, capacity development can happen in many different ways at many different levels. So.
Thank you.
And there are some good examples in the call text itself of different. We're kind of not prescriptive about that, but welcome creative approach.
I think in the call text, so although we can't fund masters or PhD, we can fund things like fellowships or secondments or specific research research training, whether it's lab skills or working in interdisciplinary partnerships. We can fund specific training courses on that kind of thing. Capacity building includes increasing people's ability to work with people in different disciplines and formation of new partnerships. It could be providing support or mentorship for more junior team members. It could be working with people who haven't previously seen their research as fitting the global health sphere and trying to reorient their skills towards global issues. So, yeah, although we can't fund masters or PhDs, there's still a million different ways that capacity building can be incorporated.
Wonderful. Okay, and then we have, you mentioned social, cultural and religious context, but not economic or political context. Would solutions-focused political economy research be within scope? There's two questions here, so maybe that'd be the first one.
Margaret, what do you think?
Well, it's the remit question that falls between two councils, really. I guess it kind of comes down to the engagement aspect of the evaluation of whether it's really engaging at kind of the community level in terms of the political economy.
Yeah. It's similar in a way to the policy question previously. So we don't want research that's just pitched at too high a level, because we're talking about the context that people live in. Of course, that's informed by the political and economic circumstances, so that's relevant. But it's exactly what they propose to do that will affect whether that's what their ideas within scope or not. So again, we'd welcome seeing an abstract of that to work that out.
Yeah, I agree. I mean, as long as if that's kind of an outcome as well, in addition to that level of engagement where it could be assessed, then certainly would fall within. It's just a question of how that engagement is occurring.
Okay, brilliant. Okay, so the second question: are you interested in the context of systemic issues, influencing health as opposed to contextual drivers or specific diseases? For example, contextual factors that determine markets for falsified medicines.
Not something that I've considered, not something that I particularly see as being directly related to an NCD or an infection. I don't know if anyone else has any thoughts.
Yeah, I guess I would say that was one step removed. So yes, I think falsified medicines is a really important issue, and how that impacted health and NCD at the community level would be within scope. But if you're looking at the drivers, if you like, of markets for falsified medicine, then I'd say that was one step too far removed, and we'd be looking at it from the bottom up, not the top down, if you like.
Okay, and we mentioned BBSRC call, nutrition in the wider environment. We've been asked, when is it likely to be announced?
So we were just discussing this yesterday, and end of February. The call is going to go live at the end of February.
Brilliant, thank you. And I think we have a couple more questions. So regarding capacity building, can funding be included to run training courses for researchers employed in LMICs, or to send LMIC researchers on a course?
Yes, absolutely.
There you go.
As long as it's relevant to the research proposed.
Yes, yeah, okay. And can community representatives, non-academics, be named on the bid as co-designers?
Well, that would be wonderful. Yeah.
Yeah.
I mean, we very much welcome that. Yeah.
Brilliant. Okay. So we've come to the end of the questions that we have on chat. And does anybody else would like to ask any further questions? Or is there anything else that we'd like to raise while we've been?
Is there anything from AHRC or natural environments that you want to stress? Or
Something specific, just that there's contact information on the call documents them to be in touch with the things that are more specific, and we are happy to continue the dialogue as that occurs.
Yeah, I mean, we haven't had specific questions on the natural environment, but, you know, we are also interested in how air quality or water quality, for example, maybe linked in and infected health. So, yeah, so please do share the information on that with your colleagues as well.
Wonderful. Okay. I think one last thing on a process side is we ask people to ensure they've read both guidance, both the MRC and also the additional guidance that we've put onto the website, and that the call does close at 4 p.m. UK time on the 2nd of April, and that we wouldn't be expecting any late entries.
And I'm right in thinking that the university research organisation needs to authorise the shared submission.
Yes, so please, please give your research officers enough time to have a read through the applications and to make sure that everything is perfect for you before they submit it. It can cause them quite a bit of stress.
And so for those people who've never submitted using the GED system before, we have guidance on what you need to do to register yourself and register your institute.
That's correct, yes.
So please look at that, look at that now if that's what you're planning to do, because in case it takes time to get that set up and to give yourself time to familiarise with the online system.
Definitely. And any questions, any queries, if you want to contact myself, samantha.palmer@mrc.ukri.org, or what we'll do is I'll put the international email address on a link to yourself with the questions and answers that you've asked. We are also recording this web seminar, which we will be editing shortly, and we're looking to put onto social media over the next couple of days. And we'll send a link to that for you as well, so you can then forward that on to any colleagues who haven't been able to attend. Okay, thank you very much for joining.
Thank you. Bye.
Bye. Thank you.